occupational health physician. I serve as the medical director for WorkCare. I'm also one of the founders and currently serve as president and CEO. WorkCare provides solutions to keep employees fit and productive from hire to retire. Essentially, it's engagement of clinical services to help employees. The nature of work does impact health. We believe that if you adopt preventive strategies, you can minimize the impact of work on health. And you know, as people age, we know through lifestyle issues, they're getting more wear and tear. They're getting, unfortunately, larger and heavier and even obese, and that impacts health, and it impacts injury rates at work. It impacts their early disability and early retirement, all of which can be prevented. A good family medicine physician is quite capable of dealing with injuries and illnesses. What they lack is what the occupational physician brings, which is an understanding of work and an understanding of disability and what drives disability. And so an occupational physician, I think, is more prepared to confront a worker who's at risk of a delayed recovery, not necessarily because of the nature or extent of the injury, but because of all of the other psychosocial factors that go along with injuries. How do you understand your workforce? Well, personally, I like to visit all the clients that we have and see the workers and see what they do a walk through of the plant, look at the job descriptions or what other job assessments they have, look at the potential for exposure, factors such as noise, chemical agents, ergonomic issues. I try to judge the morale of the work environment, and because all of those have factors that come into play when you're dealing with issues from that employer. Issues can be, as you know, work injuries. They can be trying to design a preventive program for that employer to keep the employees fit and productive. It can be, helping them with their health promotion if they have such a program. So we typically, I'll stop, talk to supervisors, talk to workers, spend a couple of hours touring the plant, and as I've done this for many years now, I'm pretty comfortable with all environments. I think I've been to most types of environments, from mines to underground mines, surface mines. Well, whether you have an on-site clinic or not depends on the company's goals and what they're trying to accomplish. WorkCare does not get involved in delivery of on-site health care for personal health issues. We tend to focus only on occupational drivers. So I would look at how many employees, how many contractors, what's the nature of the work, what regulatory processes are they involved in, because that will help drive how many medical exams, do they have a rescue squad, do they have fire drills, because all of them require annual exams. If they're in a highly regulated environment like a refinery, they're going to have the benzene, medical surveillance. So in those circumstances, you need a clinical oversight. You need a physician. It doesn't have to be daily. And you can use physician extenders such as nurse practitioners like we have at some of our projects in Alaska and in Northern California, or PAs. Some projects don't even need that level of support. It may be that they're doing a lot of drug screens for random programs, They just want somebody there for injuries. They don't really have a lot of regulated exams. And in situations like that, you could use RNs. They can be full or part-time. You could even use LVNs. You can use medical assistants, or we have found in some situations paramedics to be very good at handling injuries, and we can then mentor them into and train them how to do all of the other programs, such as drug screen collection, fit testing, even hearing tests, pulmonary function tests. And so, I mean, I like to again have a menu option for employers so that we can help them pick and choose what will work for them and what will be the most cost-effective outcome. Clients we generally like to work with are ones that take care of their employees. I think that's primary. They have to be, invested and engaged with their employees and their workforce. What we offer is a lot of icing on the cake. We can keep their employees fit and productive, but if they don't have a mentality of safety or a mentality of caring, we're not going to be their answer. We're there to help support. I can't make an unfriendly work environment more friendly because I bring stuff on site. It can help. But again, if employers don't have a goal of, safety, I think most of the employers I like to work with have safety as a core competence. And now they're translating a lot of what they've learned in safety into personnel health issues. Emergency rooms are wonderful, and they're a great asset to the nation to have. They are designed for catastrophes. And I remember when we had that terrible train crash in Los Angeles a number of years ago, reading about the physician who handled all of the injured and the people who died. And he essentially sat at the elevator as they were bringing them down from the roof. They were all transported in by helicopter, and he made life or death decisions. And then at the end of 9 hours, he remembered, oh, I left a non-serious healthcare patient in one of my exam rooms, just waiting for a prescription. So the person was waiting there 9 hours to get that prescription. Early notification of the employer, and then get the clinician involved at the first step. If it's not a 911 life-threatening situation, you have time to call a clinical resource. And that clinical resource can then help deal with the injury and direct it to the proper location. So a lot of these situations, the employee just wants to notify someone that the injury has occurred. Doesn't necessarily need care. Or if you can apply preventive strategies early on, such as elevation, ice, if it's sort of rolled his ankle, anti-inflammatories, you'll never need anything other than that. WorkCare does offer services in specific situations to help employers manage leave. Again, you'd have to analyze what the goals are. We do have absence management programs. We do administer family leave, especially intermittent family leave for major national employers. We do have a style of case management for non-occupational injuries, which is called advocacy, which is targeted at the recidivists. These are the people who are burdened with chronic ill health or just high benefit utilizers and use a lot of disability days. And if you use this strategy, you can engage them and get them more focused on function rather than the disease process. And again, our strategy with any leave is it has to be, a lack of function driving it rather than, psychosocial issues. Peer-to-peer communication is a strategy to get physicians who aren't comfortable with making return to work determinations more comfortable with what we understand about work and the nature of work, and again get them focusing on function rather than the disease process. And I have helped mentor a lot of family medicine providers, even emergency room physicians. They don't know when they're dealing with an injury what the person does, where he does it, or what the support system is at work. So their typical response in an emergency room is Vicodin, 2 weeks out of work, consult your own doctor before returning to work. And a lot of employers have on-site facilities where they have nurses who could see that person the following day and make alternative arrangements for follow-up care. So when we're able to tell the emergency room doc that we have such support, they make different decisions. We also talk to them about why they use Vicodin, and they use it because they don't know when that person goes home what level of pain they're going to have. So they give them the most escalated medication available. We would prefer that, again, they start at a lower type of medication, in preference non-narcotic, not even prescription if that's possible, and only escalated as needed. A lot of these people have the ability to contact our clinicians after they leave the emergency room if what they were given hasn't worked, and we will be more than happy to fill a prescription at that point. Yes, I'm often asked to design preventive strategies for employers, and as you know, medical surveillance is one such strategy. And medical surveillance is the process of doing health exams, screening health exams on employees that have similar type exposures. The purpose is to identify biological change before the disease process manifests itself. If you can see the biological change, you may be able to alter your preventive strategies to prevent that disease from occurring. And if you see it in one employee, it's more than likely that people who have similar exposures are going to end up having the same change. So that's called the sentinel health effect, and it's a public health strategy that goes back many, many years. And now we bring it to the workforce, it's called medical surveillance, but it's identical. The most common example I can think of is hearing. People who are exposed to noise develop a temporary threshold shift. It's a change in their hearing that is temporary. If you are able to identify it, it tells you a couple of things. One, they're exposed to noise. And if they have been using hearing protection, they're not using it appropriately, or it's inadequate to control the loss of hearing. So that, and also that other employees so similarly exposed will develop hearing loss as well. In that situation, you can reverse the temporary threshold shift by taking them out of the noise area and retesting them, and just monitoring their health over time. There are a lot of other similarities. Spirometry is another example when you're exposed to potential asthmogenic agents. Seeing temporary changes in your blood profile from chemical exposure that can be reversed with alteration of the potential for exposure. Well, in my view, every employer needs a chief medical officer or a consulting physician to help them with their workforce. They have a chief financial officer for the accounting purposes. They make medical decisions, they buy benefits, they depend a lot on non-medical people for some of these, and I think they'd have a different outcome if they got a clinician involved that can help look at their work environment, again, understand their workforce, understand their goals, and help them navigate through all of these various programs.